So a new book out this week is offering new insights into former President Trump and his administration's mishandling of the coronavirus pandemic. Nightmare Scenario paints a grim picture of the White House's response and mismanagement of the outbreak and how politics impeded efforts to contain the virus as it spread. Washington Post health policy reporter Yasmeen Abutaleb co-wrote the book and joins us now. Thank you so much for joining us. So I gotta say, when I heard about the book, I thought, oh, I have been living this story day in and day out for, over a year. What more is there? Boy, there's a lot more. And two of the things that I really liked about the book is I think we've all, if you've been following along, if you've been reading reports, have a general idea of the arc of the story, how mistakes were made. But what the book does is provide details that we were really unaware of, and also really good analysis of the people making the decisions, what motivated them based on other lives that they have lived or other scenarios that they had to go through, whether it's Dr. Fauci or Dr. Birx or Peter Navarro, who's advising the president on trade, but ended up on TV an awful lot talking about the pandemic. So I thought it was so insightful in that way. So I want to dig into some of this stuff. Among the shocking revelations made in this book is that the former president, at the very, very start of the pandemic, suggested that infected Americans who were overseas, who were outside of the country, be kept out of the U.S. And then when people sort of said, we can't do that, they're American citizens, he started to try and figure out ways that maybe he could put them someplace and not bring them back to the mainland. And he actually at one point suggested the prison at Guantanamo Bay. Can you explain, what the conversations were like, what was going on in his head and the reaction in the room?
Well, first of all, I just want to thank you for everything you said and let you know I felt the same way digging into the book sometimes. Like, I don't know that I want to relive all of this again. But like you said, I think there was still a lot to learn about how decisions were made, and there were a lot of encounters and decisions that were and were not made that we didn't know about in real time. And so much was happening at once that we couldn't always piece together how it fit together, including the incident you brought up with Guantanamo Bay. This was part of a broader theme of the president being fixated on the number of infected Americans and how it reflected on him, less so about how to keep the virus out of the United States and how to protect people and how to contact trace, but how the numbers looked for him. One thing that precedes or is around the same time as his proposal to send people to Guantanamo Bay is he calls the then Health and Human Services Secretary, Alex Azar, after U.S. officials had flown back 14 infected Americans off the coast of Japan who had been trapped on a cruise ship. And he said, that doubles my numbers overnight, which I thought was so telling about how he viewed all of this. He looked at it like he looks at a real estate listing or a golf score. He didn't want the number to go up. And that was his primary concern, not how do we keep the country safe? How do we prevent it from spreading within the United States? It was just, how do we not have these numbers that reflect on me? So his thinking was, if we put them in Guantanamo or somewhere off U.S. shores, then they won't count towards the official U.S. tally.
And I thought what really sort of stood out to me, too, was the president's management style, which has clearly worked for him, in real estate, this idea of sort of pitting people against each other and letting them duke it out, which he brought to the White House, was really, really detrimental when it came to tackling a pandemic. And particularly at the time in his presidency when the pandemic hit, because it was later in his presidency, and a lot of the voices who would have been able to sort of speak truth to him had either quit or been sort of drummed out. Can we talk about how his management style impacted the way the administration handled the pandemic?
Absolutely. This is something Damien and I focused a lot and tried to sort of show throughout the book how it was such a big factor in how badly the government's response went. There was this really toxic environment of bullying. Trump sort of created this environment where domineering and bullying personalities prevailed. So you saw it in a number of people. You saw it in his chief of staff, Mark Meadows, who bullied the doctors on the task force in the hopes of getting what he wanted. He was regularly telling people to clean out their desk by the end of the day if they didn't do what he wanted. You saw it in the vice president's chief of staff, Mark Short, in the way he sort of led the task force sometimes or tried to kind of assume control of it. And it was a really terrible environment to try to carry out this response, because you need people to unite, to put egos aside, to come together for a common cause. And instead you had these fiefdoms and these petty rivalries that were sort of prevailing over the response, and people were thinking about how to not let their rivals get a leg up on them, or how to make sure someone didn't try to cut in on what they were trying to do, as opposed to just focusing on what the country needed.
Just as an aside, I really like the way the chapters are actually sort of separated into also the number of positive COVID cases and the number of deaths. Because when you're living it, you know, you sort of forget how bad things were, and how at one point, you know, you thought it was really bad. And I remember when, you know, there was a suggestion that 200,000 Americans could die. And I remember thinking, impossible. And then fast forward to where we are today. So I think it was it's a very good timeline that you've chosen to sort of remind people about the number of cases and the number of deaths and what was happening when the first death occurred here in this country. Fast forward, and the book is separated into sort of two parts. So fast forward to when the president contracts the virus. Your book shed some light on about the former president's exact condition when he became sick with COVID. What didn't we know about his condition? And is there any insight into the risk the former president posed to the staff and the Secret Service after a watchdog report last week revealed that hundreds of them have tested positive for the virus?
To your point, I felt the same way when they had said 200,000 might die. But when the president got sick, that was exactly what had happened. It was October, and 200,000 Americans had already died of the virus. And we still hadn't really gotten into that third really devastating wave in the late fall and the winter, where, you know, up to 4,000 people a day died. And that was when the president got sick. And I think that's really important, because it was a time when the doctors on the task force were hoping he would have some kind of change of heart, especially after his infection. And he was gravely ill for the first couple of days. He tweeted at about 1 a.m. on Friday, October 2nd, that him and his wife Melania had tested positive for the virus. And then that day he was put on oxygen twice. At one point his oxygen had dipped into the 80s, which was not revealed to the public at the time. And when he was taken to Walter Reed, they sort of said it was a precautionary measure just to make sure he's okay. He's the president. But in fact, the president was a high-risk COVID patient. He was 74. He was medically obese. He didn't exercise very much. He ticked a lot of the highest risk categories. And his doctors at that point were very fearful he was going to have to go on a ventilator because his oxygen had dipped so low. And they told him, you have to go. You can either go now, where you can walk out to Marine One on your own, or if you wait till later, you might have to be taken out on a wheelchair or a gurney, and everyone's going to know just how sick you are. So he did go, and he was given access to an experimental drug at the time called a monoclonal antibody that one of the people familiar with his condition said was responsible for his rapid recovery. And the doctors were hoping this is his last chance. He can tell everyone to wear a mask. Maybe we can protect against some of the devastation of this third wave that we know is coming. But of course, we all saw he ripped the mask off on the balcony. He then walked into the White House unmasked while he was probably still infectious, passing by a number of staffers and putting all of them at risk. And I know from my colleagues reporting, Josh Dossie and Carol Leonig at the time, that more than 130 Secret Service agents had gotten COVID. There was a massive White House outbreak that weekend. People had gotten really, really sick. There was a little-known White House staffer who had to have his leg amputated. So, I mean, the risk in the West Wing was astounding. Dr. Birx at one point started to feel sick every day she went in because she felt like she was going to get sick because there were just constantly cases of COVID.
All right, Yasmeen, the book is excellent. You and your co-author did a really good job. If you think you know the story, but you have questions, those questions will be answered in this book, particularly about the motivation of some people, because it answered a lot of questions about why would that person get up and say that in front of the cameras. You answer those questions in that book. Yasmeen, thank you so much. Nightmare Scenario is the name of the book.
Thank you.